Now let's continue with direct interventions. All rehabilitation programs' general goal is to restore function. Therefore, functional training in self-care and home management, work, community, and leisure integration or reintegration is often an intervention in a rehabilitation program. Functional training focuses on activities of daily living and work functioning, but can also be sport-specific. In general, exercises are used that mimic movements and activities of the desired function. These activities incorporate strength, flexibility, balance, and coordination. In this slide, you see a debilitated patient learning how to stand from a sitting position. This is an activity of daily living. Here you see a patient learning how to descend a step with control and accuracy. This is another example of a daily activity. Here we see a patient learning to lift correctly, a normal activity of daily living and some work environments. On the left-hand side of the slide, you see the incorrect way to lift. Here she's using her back. Often people lift this way and it leads to injury. On the right-hand side, you see the correct way to lift, using the legs instead of the back. This method helps prevent injury. Here is a slide listing activities of daily living, or ADLs as we call them. You see eating, bed and bathroom, bathing and grooming, dressing and undressing, transfer and ambulatory activities, and other ADLs. Please review this carefully. This is common language in rehabilitation, and you must be able to differentiate ADLs with other activities. The hands are a primary tool for the physical therapist and physical therapist assistant, and there are several manual techniques that are used for various goals. We will discuss 3 techniques here, but understand there are many more. Also be aware that these techniques are subject to clinical research for validation of their purpose and efficacy. First, let's discuss general massage as depicted in your slide. This is a soft tissue mobilization technique accomplished with general, systematic manual strokes and used to achieve relaxation, decrease pain and swelling, relieve tension, and improve metabolism of surrounding tissues. For example, vigorous strokes can be employed to prepare a muscle for exertion. Another example is transverse friction massage, used to improve flexibility and function of muscles, ligaments, or tendons. You will learn these techniques during the program. Now let's consider myofascial release, which is depicted in your slide. These are specific manual stretching techniques designed to stretch layers of fascia that are limiting movement. Fascia is the connective tissue that surrounds your muscles. There is controversy regarding these techniques with respect to who should perform them. Some consider these techniques to require ongoing evaluation and therefore are out of the scope of practice for the physical therapist assistant. The bottom line is that PTAs may or may not perform these techniques based on state law and physical therapist discretion. Joint mobilizations are specific manual passive techniques used to reduce pain and stiffness and restore normal function when dysfunction is related to joint stiffness, or what we call hypomobility. In other words, the joint surfaces are not moving against one another correctly. Performing these techniques requires a working knowledge of anatomy of joint surfaces, and there is controversy of whether or not PTAs should be performing joint mobilizations. Again, the bottom line is that PTAs may or may not perform these techniques based on state law and PT discretion. Anyway, here we will see a short example of a therapist performing an inferior glide joint mobilization at the shoulder joint. This method is used when the person is having trouble elevating their arm due to a joint restriction.
So I'm going to show you an inferior glide of the shoulder. And so basically in this technique, it's moving the ball in the socket. So I'm going to apply a little bit of pressure on top of her shoulder, and I'm just going to glide downward and a little bit kind of angled down towards the table. And so I'm really moving the ball in the socket, stretching what we call the shoulder capsule to try to improve the mobility in that joint.
Other direct interventions include prescription, application, and as appropriate, fabrication of devices and equipment. In your slide you see 3 examples. In the left-hand picture you see a knee brace pictured here. This brace is designed to provide stability at the knee while still allowing motion. For example, this brace could be locked to limit full straightening of the leg, or what we call extension, but allow some bending of the leg, or what we call flexion. The brace you see in the right-hand picture here is used to slowly straighten the elbow. So, for example, after healing of a severe elbow fracture, a contracture may limit the person's ability to straighten their arm fully, or as what we call it, fully extend the elbow. This brace provides a slow, prolonged stretch to enhance elbow extension over time. And finally, the bottom picture is an example of a device used to help someone keep their foot from dropping. For example, if a person loses the ability to control their foot, which often occurs with stroke, the foot will drag and make walking difficult. This device keeps the foot from dropping, thus making walking easier. PTs and PTAs may also practice airway cleaning techniques. However, this is more often done by respiratory therapists. Anyway, here you see a percussive technique designed to loosen mucus in the lungs. The picture on the right shows a therapist percussing the patient's back. The idea is that mucus will be loosened and easier to expel. The picture on the left shows various positions designed to drain particular lobes of the lung. This is called postural drainage. Again, PTs and PTAs may perform these techniques, but it is more often done by others. With that said, here you see a short example of a therapist performing percussion and postural drainage. After the therapist finishes this technique, the patient tries to expel mucus. PTs and PTAs can also be responsible for integumentary repair and protective techniques. In other words, caring for wounds of the skin. Here we see a therapist performing a technique called pulsed lavage, as you see here. Essentially, water is being sprayed on the wound in a pulsed fashion, and this loosens dead tissue and cleans the area. Through the machine's suction action, the loosened dead tissue is removed. The picture in the middle depicts a wound associated with poor circulation, and the picture on the right shows the same wound after 3 months of treatment. PTs and PTAs perform these duties on a regular basis, and some specialize in this area. Electrotherapeutic modalities are yet another selection of devices we can use to treat patients, and they have several applications. These include wound healing, pain reduction, muscle re-education, and edema reduction. The examples on your slide include transcutaneous electrical neuromuscular stimulation, or TENS as we call it. This is used for pain reduction. This type of stimulation provides sensory stimulation. Neuromuscular electrical stimulation, or NMES, or NIMS as we like to call it, is used for muscle re-education. With this type of stimulation, an actual muscle contraction is produced. Electrical stimulation for tissue repair is self-explanatory. The desired effect here is to speed up the healing process. High-volt galvanic stimulation is used for swelling and pain reduction. The PT and the PTA must become familiar with the electrical parameters for each application, such as frequency, pulse rate, and intensity. You will have a class with specific details during the program for this area.